Hi, I'm Toshi Murata, the chairman of the Department of Ophthalmology at Shinshu University in Japan. I use CLALAS every day to see the patient in the clinic. In addition, as demonstrated in these three photos, I experienced these three cameras from patient side to prepare this presentation, and I liked CLALAS most. So I'm going to talk about ultra-wide field fundus imaging in everyday outpatient clinic using CLALAS. This is a case of central retinal vein occlusion with neovascular glaucoma. With CLALAS, we took ultra-wide field fundus image and high-resolution optic disc image. Actually, we didn't take two images. If we magnify this wide field image on a monitor, we can obtain a high-resolution image of the optic disc. So CLALAS 700 provides us both an ultra-wide field and high-resolution image in a single capture. Here is a 45-degree conventional photograph of diabetic retinopathy. CLALAS ultra-wide field and high-resolution image. You can clearly visualize peripheral pathology in areas missed in a conventional fundus photograph. As you may know, ultra-wide field used to mean a fight against eyelashes. Disposable speculum or scotch tape was required to push eyelashes aside for fundus imaging. When first CLALAS came to an outpatient clinic, ZEISS said, "Don't worry about eyelashes anymore." We were initially skeptical and did not believe it. So, one retinal fellow examined if it is true using his own left eye. Using scotch tape, this fellow pulled his upper eyelid to cover the pupil with eyelashes. This is the monitor for acquiring the fundus photo. We can see the fundus on the monitor during acquisition. Using scotch tape, this fellow obscured the fundus with eyelashes, then took a CLALAS image. The scanning confocal laser removed the eyelashes from the final images. It was like magic. Among 10 captures, only one image included eyelashes. This happened when we tried to take a lower peripheral image. So let's move on to the case presentations. Case 1 is the fundus of a retina fellow. He has mild myopia. This is the ultra-wide field CLALAS image of the eyelash fighter, meaning our retinal fellow. Single shot of CLALAS covers 133 degrees, and there was no abnormalities. Auto montage of two captures covers more than 200 degrees. Still, we do not find any abnormalities. Auto montage is possible up to 4 images, and this particular image sent a shock wave throughout the clinic. This image is from other ultra-wide field system, and this is from conventional camera. Thanks to clarity of the CLALAS image, we found retinal holes in the lower periphery, while in the other ultra-wide field image, holes were masked by eyelashes. Our retinal fellow fell down with shock. Then he asked me to perform prophylactic laser treatment. I did conduct the prophylactic laser treatment free of charge. He is grateful to CLALAS, saving him from a retinal detachment. The purpose of this presentation is to report on the utilization of CLALAS 700 with representative case studies. Case number 2 is neovascular glaucoma after central retinal vein occlusion. Let's see more cases. This is a case of neovascular glaucoma after central retinal vein occlusion. Mydriasis was poor due to posterior synechia. Fundus image capture was difficult with a conventional non-mydriatic fundus camera. During image acquisition, patients are asked to stare at the green light. With other ultra-wide field systems, the technician cannot see the fundus images on the monitor till they release the shutter. The patient cannot find the fixation light due to poor vision, so image acquisition was a little tricky. But with Claras, the examiner can see the fundus while capturing the image, therefore making it easier to take fundus photos for the patients with poor visual acuity. Case 3 is rhegmatogenous retinal detachment. This is a traditional 45-degree photo of retinal detachment. In order to visualize the entire retina, including retinal detachment, we used to have to take 10 to 12 images. But single image of Claras is wide enough to include retinal detachment, and haute montage of 4 images provides us peripheral images and views. In addition, the retina break is clearly visible, since Claras fundus images are in true color and high resolution. Now we understand this kind of finding in a conventional photograph indicates retinal detachment. My retina fellow asked me, is this a retinal detachment? In conventional photo, we need one more shot on the temporal side. A dark color and hemorrhage excluded the possibility of retinal detachment. With an artificial color image, it may be difficult to tell the difference, but with Claras, true color and high resolution, this cannot be a blood clot, and we reached the diagnosis of malignant melanoma. There was a secondary retinal detachment, which also suggests choroidal malignant melanoma. MRI findings also supported the diagnosis of choroidal malignant melanoma. Case 5 is retinal detachment after epiretinal membrane removal. This is an image from another ultra-wide field system, which we received in a referral letter of this patient. Clara's photo taken on the next day in our outpatient clinic clearly delineates a retinal detachment with a retinal break, which had been made probably during removal of the epiretinal membrane. This case shows that Claras provides ultra-wide field and high-resolution images even through this small pupil. Initially, we did not think Claras would be useful in the AMD clinics, but we were wrong and found that Claras provides images with higher resolution than a conventional camera. Claras 700 also provides fluorescein angiography and indocyanine green angiography with high resolution. This Claras image clearly shows multiple serous retinal detachment, and fluorescein angiography shows leakage and dye pooling in the corresponding area to the serous retinal detachment. We made a diagnosis of VKH. This Claras image shows branch retinal vein occlusion. Fluorescein angiography clearly shows widespread non-perfusion areas. Claras is useful for the imaging of branch retinal vein occlusion. Case 9 is retinitis pigmentosa. With true color, you can appreciate the progression of retinitis pigmentosa by seeing the borderline between the affected and normal retina. Fundus autofluorescence is also useful to identify the damaged and preserved retinal areas. Case 10 is macroaneurysm rupture. It clearly shows subretinal and pre-retinal hemorrhage, but vision is 20/20. With time, hemorrhage loses red color. Because hemorrhage spares the fovea, vision did not decrease. He still sees very well. The final case is hypotony after trabeculectomy. With conventional photo, everything is hazy due to vitreous hemorrhage. With other ultra-wide field system, still eyelashes and vitreous haze is present. But in Clara's image, confocal scanning removes media opacity and eyelashes, so the fundus is clearly visible. Conclusions. Clara 700 is ultra-wide field and high resolution. Clara's is eyelash-free. Among 10 captures, only one image included eyelashes. Both fundus photo and fluorescein angiography are masterpiece-level high quality. In addition, ultra-wide field. And please remember, Clara's may save you from retinal detachment. Thank you very much for your attention.